Our next speaker, Gary Hoffman. Gary's professor of medicine, the Center for Vasculitis Care and Research at the Cleveland Clinic, Lerner College of Medicine in Cleveland. He received his medical degree from Medical College of Virginia, who is now actually supporting this meeting, VCU. He did his internship in Virginia, his residency at Dartmouth, and his fellowship up in Dartmouth. He's won the ACR Distinguished Clinical Investigator Award. He's the founding co-editor of the Journal for International Medical Volunteerism. He's the deputy editor of the Cleveland Clinic Journal of Medicine. He's editor of Current Opinion in Rheumatology. And he's going to speak today on the new developments in the diagnosis and treatment of systemic vasculitis.
So the question that I would like to address is whether or not we have changed the standard of care for patients with systemic vasculitis. And I think I'll convince you that we have, although we don't fully understand all of the changes that we have made. I came across an interesting quotation from Michael Crichton, who some of you might recognize as he's unfortunately deceased now, but Michael, while he was still a Harvard medical student, had already authored several very wonderful books. You might be familiar with the Andromeda strain, which was made into a movie, Jurassic Park, also made into a movie. And it was his inspiration and his writing that led to the TV series ER. He was brilliant in many other ways, and interestingly, although medicine was the foundation for much of his writing, both nonfiction and fiction, he never actually practiced medicine. But the quote that I liked was that, and it's about history, and it relates to history in general, but medical history too. And he says that if you do not know history, then you do not know anything. You're sort of like a leaf that does not know that it's part of a tree. But in the culture of vasculitis, those of us who have worked in this area, we are part of the tree. We realize that we're leaves on a tree, and we're highly indebted to many people who have changed the standard of care since the 1980s, because it has been since the 1980s that many of the people whose pictures you see here have gone from observational studies, as we did at the NIH in the early days, to randomized controlled trials. We were able to do that by developing large multi-center consortia where we could take rare diseases and actually have enough patients to do randomized studies rather than just tell you about the next 20 years of our observations with this or that type of vasculitis. I'm particularly indebted to Tony Fauci, who I joined in 1986 at the NIH and was entrusted with overseeing the vasculitis program there. So the playing field has changed dramatically. No more just observational studies other than pilot studies that then guide us to randomized controlled trials. We have been able, without question, for this group of diseases to provide better disease control with much less toxicity than ever before. But unfortunately, we don't have cures for these diseases because in most cases, we don't understand cause. And it's very hard to get to cure without cause. Nonetheless, we have these newer therapies, but we don't have terribly long-term follow-up on many of these newer therapies, but still we have to